Well, every summer, lawnmowers send thousands of people to the ER with cuts, burns, and even amputated limbs.
In this morning's Focus on Your Health, Teresa Snow has a warning from a Missouri family who never thought it could happen to them.
Focus on Your Health is sponsored by MU Healthcare.
For most of us, mowing the yard is just another weekly chore. It's easy to forget that lawnmowers are powerful machines, and an accident can have lifelong consequences. 4-year-old Kansas Mountain is starting preschool this year with sparkly shoes and a pink prosthetic. She's come a long way since 2016 when a lawnmower changed her life forever.
She decided she wanted to ride with Dad and started running towards the mower. As he was backing up, he didn't see her, and the mower knocked her down and ran over her leg.
An accident that's all too common.
It's like a dream that you never wake up from.
According to the Consumer Product Safety Commission, lawnmower injuries send more than 90,000 people to the ER each year, including 4,500 children, and the injuries are often severe.
Lawnmower injuries are very unique in that they come in very, very contaminated, and it really limits kind of the options we have to reconstruct these limbs.
Dr. Sumit Gupta is a pediatric orthopedic surgeon at University of Missouri Healthcare. He recommends several safety precautions, like keeping kids inside or far away while the mower is running.
Be very aware of your surroundings. Children don't understand at that very young age that they can't run out into the lawn.
Dr. Gupta says children should never be allowed to ride on a riding lawnmower. They should be 12 years old before operating a push mower and 16 before operating a riding mower. Despite the accident, Kansas hasn't slowed down a bit, learning to walk and ride a bike.
She can do anything as long as she wants to and as long as she tries.
Amazing her family every day.
Do it.
Joining me now is Dr. Sumit Gupta, a pediatric orthopedic surgeon with MU Healthcare. Kansas is an active young girl, but she may have some medical procedures ahead of her. Tell me about that.
Unfortunately, she will. She was very young when she had this injury, only 3 years old. It's likely that the bone will start growing and may even grow out of the skin, and we may have to revise that stump, up to 2 or 3 times even. The second thing that I worry about is just it not growing straight and having a small deformity, which sometimes we do have to correct as well.
These are pretty traumatic injuries when you see lawnmower injuries. Tell me about them.
Lawnmower blades are very powerful, and any body part that gets stuck in the middle just gets pulverized, whether it's skin or bone or muscle. When they come into the hospital, our goal is really to stabilize them, minimize the blood loss, control the infection, and generally just close up the skin at the level that's already amputated.
Compared to a life-altering injury, the precautions are pretty easy. Let's go back over those precautions for mowing your lawn.
Well, the number one precaution to take is to not use lawnmowers with your children around. Make sure you're not riding with your children on them. Make sure the area is secure so they can't run up behind you. And it's recommended by the American Academy of Pediatrics that any children less than 12 do not use a lawnmower, and children less than 16 don't use a ride-on lawnmower. Also, some other basic precautions are to make sure you use safety equipment such as eyeglasses and appropriate shoes, and to make sure that any material that's lying around the lawn is taken care of so it can't act as a projectile and hit people when they're standing around.
Good advice, rocks and other things. So we all want our lawn to look nice, but we need to stay safe. Thank you very much, Dr. Gupta. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.